Hey, I'm Russ Curtis, and I'm going to be talking about psychedelic therapy or psychedelic-assisted therapy. You'll see it written in the literature differently now. It's a hot topic. We've just published an article in the Journal of Mental Health Counseling. I'll put the link below that you can check this out. But what we want to talk about is, in the world, there's actually been some significant advancements in helping longevity of people with heart disease and cancer, and some pulmonary issues due to early detection and proper medication and treatment therapy. And yet here in the US, we've got a suicide and an opioid crisis. In fact, you would even say an opioid epidemic right now. So some advancements in the medical world, but we need to be doing better within the mental health world. This isn't to say that counselors and behavioral health professionals aren't working very hard and doing the best they can with this. These are just tricky, difficult issues. So with the psychedelics, what they have found with, in the ones that we wrote about, psilocybin, ketamine, and MDMA were the ones. These have all been fast-tracked for federal trials and for treatment-resistant depression and suicidal ideation. In fact, ketamine, a derivative of ketamine that they're calling S-ketamine, ES-ketamine, is already on the market and is approved by the FDA for use with treatment-resistant depression and suicidal ideation. Now, this has been used for centuries. The psychedelics have been used for centuries for enlightenment and spiritual advancement and for dealing with stuff such as addiction and depression and so forth. In the 60s and 70s, due to some poorly conducted trials, it was found that there were some deleterious side effects, and so they were banned. The FDA banned their use. Now, by the way, some of these trials they would give somebody LSD and then put them in a cold, sterile room and be observed. And that's not what needs to happen when doing this therapy. So the work that's being done in the research institutes now know that the setting is incredibly important, what they call the set in the setting. This is where the behavioral health folks come into play. First, behavioral health folks and counselors need to screen clients, particularly for psychosis. If they've had prior psychosis before using substances, it could be that using a substance, being prescribed a substance in a trial could actually exacerbate that. Also, addiction, we just need to be careful because it's a balancing act in that we know that some of these substances actually can help people with addiction, but we also want to make sure that we're not maybe kicking something off so that when people leave, they start using illegally outside of the trial. So there needs to be a lot of screening and assessments before, perhaps using standardized assessments, but also an information or an interview to find out more about the person, what their goals are, what they have tried in the past. During session, these would be very well trained people to help people. They're given a dose of whatever it may be, the psilocybin, MDMA, ketamine. Typically, you're going to lay down on a comfortable couch, blanket. There's different types of music that are prescribed. The client gets to decide if there's going to be any kind of scent, a candle or essential oil, flowers, that kind of thing. And then the therapist, often two therapists would be there. And this person, I think, has got blood pressure being monitored, and it's in a medical facility in case there was an emergency. But then they're helping them maybe process some anxiety they may experience, helping them kind of go towards whatever may, what may seem like a delusion or different perceptual experiences. But they're to just help comfort and guide. Not much talk is going on. This isn't a time to be doing cognitive restructuring or reflection and so forth. Okay? And you'd have to be trained to do that, and there's more protocol coming out about that. Now, another big piece, so we had screening, we had the in-session. The big piece is processing afterwards, whether individual or group therapy afterwards, processing what they experienced in their session and then what that means for them now on how they're going to live their life, what they're feeling now in terms of the rate of depression and suicidal ideation. And there was a story in, it might have been Michael Pollan's book, and the woman said, after I got through with my session and was processing, what I found is that I no longer need the substance. What helps me now when I find myself maybe getting down is just to be able to go to somebody like a counselor be able to talk to somebody who truly listens and reflects back. And that's all I need. I just need tune-ups like that. I don't need it. So it's actually, I think the psychedelic-assisted therapy could really help bolster the counseling profession, because I think folks are going to see how powerful counseling is, whether we use the substances or not. Now, that said, psychedelics are also shown to increase neurological connectivity. And what I like to think about this, not knowing the real detailed science of it, is it kind of lights up the brain more, accessing more areas of the brain so that we're better at problem solving and so forth. So the more research to come on that, but it's looking like there could be some advantages in that regard. So with treatment-resistant depression, suicidal ideation, even some with help with addiction and enhancing functioning, which, that's a part of what counseling's about, is that wellness model and how do we help people thrive and live their best life. So a lot more to think about with psychedelic-assisted therapy, but this is an area where I think counselors could be invaluable.